Prenatal care. Prenatal care as soon as her pregnancy is confirmed to promote optimal health for both her baby and the mother. And when I say prenatal care, this refers to the steps that a pregnant female can take to provide for her own health and the health of her baby. So let's talk about the importance of prenatal care. So one of the first decisions a pregnant female must make is who will provide her prenatal care. There's an obstetrician, which is a doctor who specializes in the care of a female and her developing child. There's also a certified nurse midwife, who is an advanced practical nurse who specializes in prenatal care and developing and delivering babies. The mother-to-be must also decide where the birth will take place. In the United States, most births take place at hospitals, but some women choose to have their delivery at home or in a birthing center. A birthing center is a facility in which women with low-risk pregnancies can deliver their babies in a home-like setting. But regardless of where the birth takes place, a doctor or a certified nurse midwife should be present. During a prenatal visit, the female will have a complete physical that includes blood tests and pelvic exams. The purpose of the exam is to identify problems so that they can be corrected or treated as early as possible. The obstetrician or nurse midwife will monitor the mother's weight and blood pressure. Often the developing baby will be viewed with an ultrasound machine. The visits also give the parents-to-be the opportunity to ask questions to learn about the important behaviors that can help ensure the health of a baby. So now let's talk about proper nutrition during pregnancy. Now we've already talked about nutrition. So what do we need for healthy development? We've talked about this before when we talked about nutrition in chapter 5. So just real quick, think to yourself, what do we need? And what have we learned this semester that gives you an idea of nutrients? Right? Think of the stuff we've covered already. So let's go over some of these key nutrients. First one, calcium. This helps to build strong bones and healthy teeth and healthy nerves and muscles. It is also important in developing heart rhythm. We need protein. Protein helps form muscle and most other tissues. We need iron, because iron makes red blood cells and supplies oxygen to the cells. Vitamin A, which aids in cell and bone growth and eye development. And then we talked about folic acid this semester already too, which is a critical part of spinal fluid and it helps close the tube that contains the central nervous system. The neural tube forms 17 to 30 days after conception, so neural tube defects can occur before a female knows that she is pregnant. Healthcare providers suggest that all females of childbearing age consume 400 to 600 micrograms of folic acid daily to prevent these defects. And although a pregnant female nutritional requirements may increase, she must be careful not to gain too much weight. Most pregnant females need only 300 additional calories per day, about the number of calories found in 2.5 cups of low-fat milk. Most healthcare professionals suggest that females who are at a healthy pre-pregnancy weight gain between 25 and 35 pounds during pregnancy. Excess weight can be a health risk to both mother and baby. And so we need to make sure that, just like we talked about earlier this semester about having a healthy weight, there's a healthy weight for being pregnant. You can't just put on as much weight as you want. 25 to 30 pounds is the max you want to put on during pregnancy because it can lead to damaging the baby or it can make the birth harder on the mother. And so how do we do that? So one, we need to have enough physical activity. 150 minutes of aerobic activity spread out over the week, or 30 minutes of moderate exercise per day. Okay, again, we only need to increase our calories a little bit, and then we need to make sure we have the proper nutrients for healthy development. Now let's talk about other things that affect the health of the fetus. So a pregnant female must be careful about the substances she takes into her body. Tobacco, alcohol, and other drugs can enter the body of the developing fetus and have harmful effects. So tobacco and pregnancy. Smoking during pregnancy is estimated to account for up to 30% of low birth weight babies, 14% of premature births, and 10% of all infant deaths. Studies suggest that a pregnant female smoking may also affect the growth, mental development, and behavior of her child until he or she is 11 years old. The only sure way to protect the developing fetus and child from negative effects of tobacco is to not smoke. The responsibility to provide a smoke-free environment extends beyond the expectant mother. According to the American Lung Association, pregnant females exposed repeatedly to secondhand smoke also have an increased risk of low birth weight. Low birth weight is a leading cause of death for children under 12 months old. Then we have alcohol in pregnancy. Any alcohol consumed during pregnancy quickly passes through the umbilical cord to the fetus. The fetus breaks down alcohol much more slowly than the adult does, so the alcohol level in the fetus's blood can be higher than that of the mother and remain higher for a longer period of time. An elevated alcohol level can result in permanent damage to the fetus and a condition called fetal alcohol syndrome, which is a group of alcohol-related birth defects that include both physical and mental problems. The serious lifelong consequences of fetal alcohol syndrome should not be overlooked. It's very important. Then we have medicines and other drugs. So using drugs when pregnant can have serious consequences. During pregnancy, even prescription or over-the-counter medications should be taken only with the approval of a doctor or other qualified health professionals. Using illegal drugs when pregnant poses a serious health threat to both the mother and the fetus. During drug abuse can harm the mother's health and make her less able to support the pregnancy. Drugs also can directly harm fetal development. The use of certain illegal drugs during pregnancy can cause serious birth defects, premature labor, or miscarriage. In addition, a baby can be born addicted to drugs that the mother uses during pregnancy. The infant will suffer withdrawals when it is no longer receiving the drugs after birth. The baby may become hypersensitive or irritable and may cry for hours. It may tremble and jerk. A baby addicted to drugs may fail to bond with its parents as normal babies do. And now I've seen this firsthand. My wife's cousin adopted a baby whose mother was addicted to meth over the course of the pregnancy. And so she was born addicted to meth. And so her first couple weeks of life, she was going through withdrawal symptoms. And that had certain mental side effects on her that are still lasting to this day. And now she's 12. So now let's talk about other concerns and complications. So let's talk about environmental hazards. So harm to the fetus can result when a pregnant female is exposed to some common substances in the environment. Being familiar with these substances can help a female avoid exposing her unborn child to the harmful effects. First, we have lead. Lead exposure has been linked to miscarriages, low birth weight, mental disabilities, and behavioral problems. Now, lead can be found in paint of houses built before 1978 and can leach from old pipes into tap water. And so a lot of times with older homes, they have to go in and fumigate and remove all the lead when they do remodeling. Smog in recent studies have been linked air pollution with birth defects, low birth weight, premature birth, stillbirth, and infant death. The greatest risk occurs during the second month of pregnancy when most organs and facial features develop. Now, if you think about the news, when you hear stories about China has very high air pollution. And so most time when women are pregnant in China or other areas where there's high air pollution, they have to wear masks just to decrease the chance of birth defects. There's radiation. Ionizing radiation, the type found in X-rays, can affect fetal growth and cause mental retardation. Other types of radiation, such as those from video displays, color TV sets, and microwaves, have not been shown to be harmful. And the last one is kitty litter. So cat feces may contain a parasite that can cause a disease called toxoplasmosis. This disease can result in miscarriage, premature labor, and health problems in a newborn. Pregnant females should wash their hands after petting a cat Have others clean the litter box, and wear gloves when guarding where cats may be present. In addition to this, we also need to be aware that using household chemicals, pregnant females should read the cautions on cleaning products, wear gloves, and work in well-ventilated areas. So let's talk about complications during pregnancy. So first we have a miscarriage. A miscarriage is a spontaneous expulsion of the fetus that occurs before the 20th week of pregnancy. Now, if a dead fetus is expelled from the body after the 20th week, that's what we call a stillbirth. And so women who use tobacco and drugs during pregnancy are more likely to experience a miscarriage or stillbirth than those who abstain from those substances. Now, miscarriage or stillbirth doesn't necessarily mean that the mother did something wrong. Receiving the proper prenatal care during pregnancy can reduce the risk and severity of the problem, but it doesn't completely remove it. I know multiple people who have had miscarriages even though they're going through the proper prenatal care. Now we're going to talk about ectopic pregnancy. Now, ectopic pregnancies result from the zygote implants in the fallopian tube, the abdomen, the ovary, or the cervix. Ectopic pregnancy can occur when the fertilized egg can't pass to the uterus, sometimes because inflammation or scar tissue that has developed as a result of an STD. The fetus can get the nourishment it needs to grow normally. The situation is a threat to the pregnant female's life. Ectopic pregnancy is the number one cause of pregnancy. The treatment is a removal of the fetus from the female's body. And then we also have preeclampsia. Preeclampsia, also known as toxemia, can prevent the placenta from getting enough blood. The condition may result in low fetal birth weight and problems for the mother. Symptoms of preeclampsia in a pregnant female include high blood pressure, swelling, a large amount of protein in the urine. Treatments include reducing blood pressure through bed rest or medicines. In some cases, hospitalization is necessary.